what are the things that for the normal people, they can benefit from the physical therapy?
Yeah, absolutely. So we have worked with a lot of people, and I call it prehab, where they will come in and they'll say, "Hey, something's kind of going on. Maybe they're not even in pain, but they're like, I really want to get back to the gym, but I just don't feel like I'm at a good level to where I can just walk into a gym and start lifting things, or even at the level where they can go see a personal trainer yet." We would give them kind of some exercises that would help prevent injury and some corrective exercises for maybe some posture, some improved biomechanics with lifting, and give them some kind of like a base level foundation before they transition back to normal exercise. Or if they're just having issues, if biomechanically something's off, they feel like their gait all of a sudden, the way that they walk is wrong, or their mobility in their shoulder or something is decreased, they would come see us and we would be able to give them some corrected exercises and give them some input on how to fix those things.
Mm. So basically, in your settings, helping people to correct the exercise. And I remember that you mentioned that you also doing the manual therapies, right? What is that?
So there's a lot of different techniques that we use outside of just the exercise. And this is what I always say. So we do what's called manual therapy. And manual therapy is kind of the jump start that would get somebody feeling better, moving a little bit better. And then the exercise is what actually makes the lasting change in the tissues. But some of the manual therapies that we perform are a lot of hands on soft tissue work, joint mobilization. So, somebody comes in with a real stiff joint or stiff back, some of those hypermobile segments. We'll do manipulation on those segments to get them moving, get them little bit more pain free, some joint mobilizations. We would also use soft tissue techniques called dry needling, is a technique that I use where there's a trigger point in a muscle, and we take a needle very similar to an acupuncture needle, and we insert it into that trigger point. You get a twitch response, and that will help that muscle release, relax. Very effective. Lots of different, we use cupping techniques, and we'll use some instrument assisted soft tissue massage, or use kind of a tool to help manipulate the muscle and the fascia just to help it release and relax, reduce the nervous system, especially if the nervous system's aggravated and they're in here in a lot of pain, a lot of muscle tone. Will help reduce and relax that before they go and do the exercises, so that they can be more pain free when doing the exercises. And there's a lot of carry over with that to normal function.